Conduction problem in distal part of left bundle branch. At this point, it is worth considering in a little more detail the anatomy of the branches of bundle of His. The right bundle branch has no main division as it is smaller compared to the left ventricle, and left ventricle is larger than that of the right ventricle, and the left ventricle has to pump the blood throughout the body while the right ventricle has to pump the blood towards the lung. As the mass of the left ventricle is larger than that of the right ventricle, so will it have the more blood supply from its arteries, so it will have the more supply, nerve supply, so it will have more pathway for the conduction as well. So the right bundle branch will not have the further branches, while the left bundle branch has further divided into the anterior fascicle and the posterior fascicle. Depolarization wave therefore splits into the ventricle by the three pathways. So what are those three pathways? I can show you over here. So this is the three pathways. So this is the AV node, this is the bundle of His. So this is the first right bundle branch. This is the first pathway. And before, grossly we have said that the right bundle branch, left bundle branch, but the left bundle branch has more ventricle mass, so it has two fascicles, the posterior fascicle and then after the anterior fascicle. So it will have the three further branches, that is right bundle branch, anterior fascicle of the left bundle branch, and the posterior fascicle of the left bundle branch. And we know that from the before videos, the cardiac axis depends on the average direction of the depolarization of the ventricle, because the left ventricle contains more muscle than the right. It has more influence on the cardiac axis. We all know that it will have more influence on the cardiac axis. You can see over here. You can see due to the large muscle mass, I have made the direction look little bit more over here. Well, this has very little influence on the direction of the wave of depolarization. So in comparatively, it will show the axis of deviation, wave of depolarization in here. So this is the normal axis of the deviation. The anterior fascicle of the left bundle branch fails to conduct. The left ventricle has to be depolarized to the posterior fascicle, and so the cardiac axis rotates upward as shown here. If the anterior fascicle fails to conduct, right, then the conduction will be from the right bundle branch and the posterior fascicle of the left bundle branch. And you know that this has the more muscle mass, so it will have more effect over here upward for the axis of deviation, and there will be only slight. So what will it will lead? Then the mean average direction will be over here, as soon like this. So this is from the normal axis of deviation, it is going towards, because the normal axis of deviation is over here, but our axis of deviation is moving here. So it is moving from, it should happen here, but it is moving upward. From the initially it is moving towards the left. So this is left axis deviation. But when the posterior fascicle of the left bundle branch is only rarely selectively blocked, in the left posterior hemisphere, but if this occurs, the ECG shows the right axis deviation. So that was about the what did happens if the anterior fasciculus would have been blocked. So what if the posterior fascicle is blocked? Then this is the right bundle branch, this will be the left bundle branch. The right will be showing it will be showing the little bit effect here, but the posterior fascicle will be showing towards here. As this has more influence, this has more mass, so this will have more influence. So the axis of deviation will be here. And comparatively from the above, the normal axis of deviation is here, but now this is moving here. Before the normal should have been here, but now this is moving here. So what is this? This is right axis deviation. So the block in the posterior fascicle will cause right axis deviation. So what happens if the anterior fasciculus is conducting, posterior fasciculus is also conducting, but the right bundle branch is blocked? This is the right bundle branch, and what is here? This had only little influence. Before also this had only little influence over here, but the influence of the bundle branch is here, and that mean will be over here, so that will have no effect. That will be the normal axis deviation. And now what if right bundle branch is also blocked and the anterior fasciculus is also blocked? Right is blocked, anterior. So what if the right bundle branch is also blocked and the anterior fascicle of the left bundle branch is also blocked, and only the posterior fascicle is conducting? This will have the more effect over here. There is no any axis to contribute to the wave of depolarization, so this will move upward, but the normal would have been here, but this is moving upward. That means the axis of deviation is shifting towards the left, so that will cause the left axis deviation. As you can see over here, here you see QRS, then T, then P, then QRS, T, then P, then QRS, T, QRS, T. So this is sinus rhythm. So you can write that this is sinus. Then after we'll see the rhythm of the heart, that is rate. We'll see the rate of the heart. Then you can see over here, this is RR wave. Here is one, this one, here is one, here is one. Okay, you can see here 1 2 3 and half, 2 3 and half, 1 2 3 and half. So 3 and half means like 3 or 4 bucks. So 300 divided by 4 bucks equals to 75 beats per minute. And if it had been 300 divided by 3, then it would have been 100 beats per minute. As if we have 3.5, then that will means that between the 75 and 100. So between the 75 and 100, you can take like 88 beats per minute. So bits is 88 beats per minute. That is about. We have completed the P wave. Then you can see for the QRS PR interval. I think the PR interval is also right. So this is no prolongation. And then after P wave, then you will see PR interval. Then after PR interval, then you will see the QRX. And if you see over here QRS, it is more than 1 to 3 bucks. But I think this is also normal. And then after you can see this is normal QRX. And you can see this is pointed upward, this is pointed downward. Upward, downward means they are now upward, downward means left axis deviation. Because they are giving up, they are going downward. Before they were progressing, but they are now going downward. This is left axis deviation. This is only the mnemonic to understand. So upward, downward, this is left axis deviation. And then after QRS, then you will see ST segment. I think ST segment are also normal. Then T also normal. So this will show that sinus rhythm with left axis deviation is the diagnosis. But I have only seen the 2, and you can scan for the rest of the lead. So all of them appears to be somewhat normal. So the final diagnosis is left sinus rhythm with left axis deviation. Okay, well there is P, here is Q, here R, then here is S, then here is T. Okay, P, then here is PR interval, then Q, then R, S, T. So P, Q, R, S, T, P, Q, R, S, T. So it shows that it is normal too. Then after I'll just scan over the rest of the lead, and I see over here opposite to the 2, it must be inverted. There must be T wave inversion, P wave inversion. So I will see that if there is not or not. So P, Q, R, S, T, they are inverted. So this is correct. Okay, I have just scanned the 2 of them. Then after that I will like to scan the overall and see if there is any abnormality happening or not. So if I look over here, then I think there is some abnormality over here. I feel something, there is unusual things happening over here. I feel there is something unusual, unlike the previous ECG I have seen. And I see here this is slightly the R interval, sorry, S is large than the rest. So these are the things I see abnormality, and I'll be focusing over here while reading the ECG. And I'll do the rest of the things following the PQRST pattern. So following P, I can say that this is sinus rhythm. And I will like to calculate the heart rate. So R will be here, so R will be here, here, R will be here. So reading 1, 2, 3, 3.5, 1, 2, 3, 3.5. So 3.5 bucks. 300 divided by 3.5 means like about, if it had been divided by 4, 75. If divided by 3, it had been 100. So it is about 90 beats per minute. So sinus rhythm 90 beats per minute. And after following, I'll be doing the reading on the basis of P, Q, R, S, T and U pattern. So following this, I have done the P wave. Then I'll be going to the PR interval. And I see that PR interval, they are 1, 2, 3 bucks. 1, 2, 3 bucks. So there seems to be normal, and it doesn't seem to be first heart block. So our second degree, first degree heart block or second degree heart block. So I don't see. So the PR interval is also normal over here. And I'll see the QRX complex, whether they are large or not. So while looking QRX complex, I see they are normal over here. Normal. But you seeing over here, you see, what do you see is there is P, slightly P, but then there is no Q, but R and S, then R, then T wave inversion. And then again after you see there is P, then R, S, R, then you see T, then P, then again see R, S, R. So you see R, S, R one pattern. It is not the M pattern. If you see M pattern, this will be over here, and M is like, you must have the M is like this, right? M is never like this. It will not go down beyond this. So you can see here, this is going below the isometric line. So this is RS1 pattern. And if you see RS1 pattern in the B1, that means there is right heart block. That means right heart block. That means the right bundle branch block. So this is right bundle branch block, sinus rhythm, and no need to mention this is normal. PR interval is also normal. Sinus rhythm, right bundle branch block, and you can see there is a wide S segment over here in the V6. So looking at this, then after QRX, reading the QRS, we'll go to the deviation, angle deviation. You see upward, then downward, then downward. This is the left axis deviation. But the thing is that if there is only right bundle branch block, the axis deviation should have been normal axis deviation. Then so much of the deviation towards the left should not have been seen, because this doesn't really interfere with the, this must not have really interfere to the axis of deviation. As you can see, this is the bundle of His, this is the right bundle branch, this is left bundle branch, this gives the anterior fascicle, this gives the posterior fascicle. Posterior fascicle will show the wave of depolarization over here, this will show the wave of depolarization over here, and this will relatively cause the wave of depolarization, sorry, this will cause the wave of depolarization to be over here, and this is large ventricular mass, and this is small. Right ventricular mass is very small, comparably less muscle mass. So the right bundle branch block, so the right bundle branch would be causing the axis of deviation over here. But if you make the vector combination of these two, this will show the cardiac normal axis deviation towards here. And if this is blocked, if this is the right bundle branch block and this is causing, then the axis of deviation should have been just over here, but not the left axis deviation, not so much. But it shows that the left axis deviation is much more. So then what might be the cause that is causing it? So that might be that this, well, and if this is already blocked, now see over here, this is the one and this is the one, this is contributing towards the left, this is contributing towards the right. So what might be the reason that it is getting overhand towards the left axis deviation as seen in this ECG? That means that this contributing factor is also being hampered. So you can guess that this is the right axis. So this is the case of the right bundle branch block. So this is confirmed, this fascicle is obstructed, and looking towards the left bundle branch, which fascicle is blocked, we can guess that this is the one which has been blocked, because this is going towards the left axis deviation and this is also blocked. Now we can guess that, we can be confirmed that this is the one taking the upper hand, and this is causing the left wave depolarization. So the right diagnosis will be, this is the bifascicular block, this is the bifascicular block, sinus rhythm with heart rate of 90 beats per minute, and the bifascicular, that is right bundle branch block with anterior fascicle, of anterior fascicle of left bundle branch block, okay, of left bundle branch block. So this is the diagnosis of this.